Welcome to the Dr. Duncan Show. I'm your host, Dr. Duncan. In today's show, I'm going to want to talk a little bit about arthritis because I get to hear a lot of questions from patients that come to us. I get to hear a lot of patients ask me about arthritis, about their grandparents that are suffering from arthritis. And so it has become a very, very important thing and a very important topic for us to make sure we educate our patients about what is it about this arthritis that people hear all the time. First and foremost, I want to make sure you understand several things. Number one, when you hear the word arthritis actually means a combination of a lot of things. And so there are different types of arthritis. And these different types of arthritis have different causes. And so depending on the cause of your arthritis, then that is determined what the name is given. First and foremost, we have two major types of arthritis. We have what we call degenerative arthritis, and the degenerative arthritis has a lot of other branches or a lot of other subtypes. And also we have what we call the major other type is what we call the rheumatoid arthritis. Rheumatoid arthritis in definition is genetic. That means actually you can go to your doctor and they can do a blood work and find whether you have the factor that in your blood system that is predisposed for rheumatoid arthritis. And so that can be determined even at a early age. But when it comes to the degenerative arthritis, which is the common type of arthritis, there are other little different types of those ones. And there are those, for example, we can talk about a gout. People don't understand gout is a form of arthritis. There is what we call lupus is a form of arthritis. There are other types of arthritis like degenerative disc disease, which is a type of arthritis. And so when you are talking about a grandma or a grandpa that is having arthritis, I want to make sure you always find out what is really causing this arthritis and what type of arthritis it is. Because depending on the type of arthritis, it actually determines what are the ways that are used to treat that kind of arthritis. In our office, basically being a chiropractor, we see a lot of people suffering from degenerative disc disease, which is a form of arthritis. Number one thing is when we get to see people with degenerative disc disease, which is a form of arthritis, we always shoot an x-rays to see what could be causing this kind of arthritis. Because a lot of it I've seen actually in our office is caused because of trauma. And what do I mean by trauma? Either somebody like 20 years, 30 years ago, they were involved in an accident and the joints locked up. And then the disc started to degenerate because the joints got out of alignment, and because the joints got out of alignment, they healed wrong, and that restricted the range of motion. When the range of motion is restricted and compromised, then what we find out is that as the years go by, they develop what we call degenerative disc disease. Now, for us to really understand this and to comprehend this very clearly about what we are talking about in this topic about arthritis, which is actually number one cause of disability when it comes to the elderly. And so this is a topic as a chiropractor, as a physician, we cannot afford to educate our patients, because if we can give them the help they need so that as they get older, they don't develop those conditions, then we'll keep them healthy and smiling. But just to come back here, I want to give a little synopsis or a little introduction about what a spine looks like, because a lot of people, they have never even seen their x-rays, so they don't know. They hear I have a disc or they have a vertebra, and they have never really known what a vertebra looks like or what a disc looks like. But when you look at the spine here, we have a model of a spine basically here. And we always like to make sure that everybody kind of looks at it and enjoys the way this body looks. And so first of all, we have the brain that sits on top here. And so this is where the brain sits on the skull here. This is the heart skull. And the reason why it becomes so important is that when you think about the brain, actually, the skull is protected by a skull. That means because of the protection by the skull, there is nothing that is supposed to interfere with the brain at all. There's nothing that is supposed to interfere with that. And because of that, what we find out is that all the other things that are very essential to the body, meaning that things that make your body to function well, they are also protected by a very hard bones, and those from the brain we call them vertebrae. So we see the vertebrae comes from the brain. You know, we have the ones that come close to the brain, that is the atlas, and they go all the way down to what we call the tailbone. And these bones here, the vertebrae, are hard and firm. And the reason why they are that firm and hard is because they protect the most important part of the body organ. And what is the most important part of the body organ we have is the brain. Because without the brain, then there is no communication. But when the brain is there, the communication is there. And so we find the brain is connected to the rest of the body by what we call the spinal cord. And this is part of the spinal cord that runs from the brain all the way down to the tailbone. And when you look at those definitely nerves through the spinal cord, we have the nerves that kind of come out of the spinal cord. And some of these nerves, and actually all the nerves, either they'll go to the muscles or they'll go to organs. That means the nerves will tell the organs what to do. If it's the liver, they'll tell the liver to cleanse the blood. If your blood is not cleansed and is filled of stuff, actually that can cause high blood pressure, because your heart has to work harder to supply oxygen to the body. And so that is why it's so important making sure the nerves are free from interference becomes important. Now, the reason why it is so important to understand about our spine as we talk about arthritis is so important is because most of the arthritis that affect the spine has a lot of consequences and compromise the people's health. Because if there is arthritis or degeneration of the disc of the nerve that either sends message to the liver, then the liver is not going to function at 100% because it's not getting the communication or the message that it's supposed to do. If the nerve is going to the pancreas, then the pancreas, and there is arthritis that is compromising the information system from the brain to the pancreas, then the pancreas is not going to contribute to the insulin production, which is the thing that causes diabetes. And so, even though this might look simple, it can be complex, and it can be complex in the sense of if we keep the system together, we'll keep our health better and better. But in the meantime, I want you to understand that if we have, as we can see, we have the vertebra. When you have the disc compromised, and what I mean by compromised is, for example, like this disc here is thinning, meaning that it's getting smaller in size compared to this here. So what happened is, because this disc has become smaller, basically meaning it is compromised, it is putting pressure on the nerve. And so this nerve is part of is what we call the L4, L5 nerve root. And actually this is part of the nerve that goes to the legs, supplies information system to the legs. And what happens is, if this nerve is compromised, it can cause what we call sciatic nerve pain, which can make people have to have surgery. And so all we are saying is, when we are talking about arthritis, I want us to make sure we understand that if there is compromised disc or there is compromise of this joint, it's going to lead to other issues. And so I want to make sure that if you have any question as we come to the next session, give us a call. Our number is 248-398-1650. Give us a call, 248-398-1650. Have a wonderful day. Thank you.